Voice of San Diego podcasts are sponsored by the Bob Nelson Charitable Fund, honoring the San Diego Harbor Police Foundation.
I think camping's a really interesting one because on the one hand, it's all outside and you're only going to be inside any enclosed area with people you're already with. But you will use the bathrooms. That's where you'll interact a lot with other people's experiences. But
that was so gross.
That's the grossest thing you've ever said.
Yeah, that's like the first euphemism that's considerably grosser than just saying the thing.
Welcome to the Voice of San Diego podcast in partnership, News Radio 600 Kogo. My name is Scott Lewis. I'm the CEO and editor-in-chief at Voice of San Diego. I'm joined, as always, by assistant editor Andrew Keats. Hello, Andy.
What's up, bud?
Managing editor Sarah Libby. Hello.
Hello.
Coming up on the show today, we can go to restaurants now, I guess. The question is, will anybody? You can also go to hotels now, except that you can't go to hotels now. They won't be open until phase 4. We're in phase 2 plus, phase 2 supreme right now, not phase 4. We have turned up what looks like another mixed message as it comes to the tourism industry, what's open, what's not, and what industry leaders are doing to make plans for the future. And school districts throughout the state warned state lawmakers that they could not, in good conscience, that was their quote, open this fall if the governor gets the budget cuts that he has proposed. Things may be opening, but this is turning into a nightmare for parents and students and teachers and staff because there is so much unknown. We'll break down what we do know. And finally, we have an update on Assembly Bill 5, AB 5, that law that just keeps delivering controversy. But also in the second half of the show, we have a UC San Diego epidemiologist, a professor of infectious diseases who I spoke with about how you evaluate risks and what the near future could look like for testing and contact tracing and why that matters. A great discussion with Dr. Rebecca Fielding Miller. I enjoyed that conversation. We are settling into what I think is the sort of general restriction, the sort of base restriction. Every restriction is being boiled off now, one by one, week by week, into you can't gather indoors. You shouldn't gather indoors unless it's a casino, which they can do apparently what they need to do. Wednesday, the California Department of Health gave San Diego County the okay to allow restaurants to open. You can also walk into stores now, which, by the way, seem kind of overrated. I've done a lot of curbside stuff these days. It's been great. But yes, now you can actually walk in and peruse the shelves with your mask on. The county board asked for these changes unanimously and got it. And they also asked in a 4-1 vote for the state to let barbershops, nail salons, gyms, and outdoor church services proceed. The one no vote, of course, was County Supervisor Nathan Fletcher says we got to get through phase 2 Supreme first. So I guess the question is, will people actually go? It seems like there's a divide right now between people who think that the government right now is the problem and that the government needs to pull back. And there are people who think that the problem is actually the pandemic and that we need to deal with that. And those two sides seem to be even more stark these days. I don't know. Will you guys go get a burger now? Sit down?
I think the one thing that's holding me up is the requirement to put the mask on and off, like as you're eating and not eating.
Is that real? Is that what's expected? That you have to have it on, except
so.
When you're
like going to restaurants is literally the best part of my life. It's the thing I treasure most in the world. I grew up in a restaurant. I love food dearly. And like, I really just can't picture this, like taking the mask on and putting it like the off and on is what is a hang up for me.
Yeah, it just doesn't seem like an incredibly attractive outing to me. The under the circumstances, which seem appropriate and seems like the right set of rules if you're gonna have them reopen. But in those circumstances, I'm probably, as a consumer, just going to stay home or do carry out or something. Sitting in a sparsely populated restaurant, because it has to be sparsely populated, with servers wearing masks and potentially having like plexiglass shields up, where I'm supposed to have a mask on if I'm not eating or drinking. It takes all of the relaxing experience out of the restaurant experience. I mean, in some ways, like, going to a restaurant is about convening a group of people. And so now if I can only go with people in my household and then I have to behave in all these ways, again, that probably is safe, but it isn't something that I'm going to especially look forward to or spend my leisure time doing.
Yeah, I feel like what we're dealing with is like this kind of big community trauma. We've been traumatized by this experience, and I feel like going to a restaurant with all of those masks and all those things out is just kind of like going to having a car accident and then going to a restaurant with a big picture of a car accident. You know, it's like, it doesn't like it wouldn't be relaxing. I think I'm more liberal than my wife. I think I'd probably go if people wanted to and such, but I'm not really that anxious to.
Yeah, I feel like I'm willing to like sacrifice a lot of pieces of the experience, and like the masks, the plexiglass, all of that I'm willing to endure because I care so much about eating food. And ever since I have a small child, like, restaurants have ceased being a leisurely activity for me. It's actually quite stressful to be inside a restaurant.
It gets better, but yeah.
I just want to eat the food. Like, a takeout taco doesn't work. And even then, like, I'm finding there are still hangups that I don't know if I can get past.
Yeah, Andy, you mentioned the scene in Jaws where they open up the beach and tell everybody to have fun, and everybody kind of like mimes it, but it's just doesn't feel there.
Yeah, they're scared. They're scared, so they're not having fun. Those two things don't go together. As long as you're scared, it's not a fun, relaxing beach day. I will say, back to your original point about folks who believe that the government mandate is the issue versus the pandemic itself being the issue. I mean, I suppose there's a certain ideologically focused person who can split that baby and say, like, the mandates offend me as like a constitutional principle.
Mm-hmm.
And whether people act on them is immaterial. I just want them to be open because they should be open, and individuals can make whatever decision they want once they are. But I don't think that that's like a meaningful size of the population. They might be overrepresented in media or in government affairs, but I don't think most people are thinking in terms of what we're allowed to do as opposed to what we will do.
Yeah, and I think that's why I was enthralled with your interview last week with Howard Blackson about dining out. I think there has to be something that addresses the trauma, that rebrands the experience away from it's just the old way with all of these restrictions, all these inhibitors to the way the old way used to be. Like, you have to somehow redesign the experience, or else it's just not going to click, I don't feel like. And another industry that's dealing with this, our reporter Lisa Halverstadt had the story this week about how hotels and the tourism industry are dealing with it. She discovered something interesting. People appear to be going to hotels. Obviously, the market collapsed. It's nowhere near what it normally is, 90% drop in revenue. And the county says that hotels should be only accessed right now by essential workers who need to have them, maybe need to isolate from their families or something like that. And the county doesn't expect that to change until it's phase 4. Remember, we're in phase 2. Phase 3 is you can go to gyms and stuff like that. Phase 4 is we're back, baby. You can go to the ballpark. You can go to concerts, stuff like that. That seems like a pretty long way away. And yet, during the week of May 3rd, Tourism Authority officials saw a spike of about 15,000 nightly bookings. Bill Evans, who runs Evans Hotels, the Catamaran, Bahia, the Lodge at Torrey Pines, he said, yeah, we're doing this for people who are, workers, essential workers, but also, anyone else, the staycationers can come and shelter in a hotel room just like they can shelter in the condo. It's for a change of scenery. So seems like there's another one of these dissonance moments. I asked the epidemiologist we're going to talk to later, like if she'd go to hotels. She says she's not worried about necessarily her experience and her risk, but the workers there and how many people they interact with. So, yeah, it feels like there's been this real big disconnect between what's supposed to happen, what's official, and what people actually end up doing.
Probably wouldn't indulge in the continental breakfast.
Yeah, buffets like
steer clear of the make your own waffle machine. So the other interesting thing that came out about Lisa's story on this was that the tourism industry here has kind of changed their footing and said, for the time being, we will spend our money promoting ourselves to staycationers. Now that could mean people in San Diego looking for a change of scenery, somebody who lives in a neighborhood of the city that decides they're going to spend a weekend at the Bahia. But it could also extend up to people from Riverside or LA or Arizona who are likewise, their trip to Hawaii was canceled, so now they're going to do this for their vacation. That is interesting to me because just the as a regional economy, the promise of staycation dollars is so much less than the promise of outside dollars. When you've got people coming from elsewhere to stay at local hotels, it is almost like an export. They're bringing money from outside of the regional economy into the regional economy, so there's a multiplier effect there that's just not present if I go stay at the Bahia. The idea being, if I didn't go stay at the Bahia, I would presumably spend that money on other things in this area. Now, that calculation probably changes quite a bit in a unprecedented pandemic, but it's nonetheless another example of just how much things have changed for our economy.
Okay, also driving my own personal panic is the issue of schools. Obviously, I've talked a lot about it. Now we have a 13-year-old living in our house who's going to be going to high school, and I brought her to live with us specifically to give her a better educational future, help her get through this crucial high school years, and that plus my own two kids. Very worried about what happens to schools and how they open up. Distance learning has been kind of a nightmare. And then this week, 6 of California's biggest school districts told state lawmakers they cannot, in good conscience, open in the fall if the state follows through with what looks like a 10% cut to their funding. I saw this come up in Cindy Martin. She's the San Diego Unified School District superintendent. She does a live broadcast on Facebook every Monday morning. And she mentioned this, and how she put it really just drove it home.
Country. And I want you all to know that San Diego Unified has joined with some of the state's largest school districts to advocate for adequate funding. Collectively serving nearly 1 million students, we have sent a message to Sacramento, a clear warning to Sacramento that schools cannot continue to operate safely in the fall if there's a declining state budget for education.
So that was jarring, and then it just kept delivering. Richard Barrera, the San Diego Unified board member, spoke with our Will Huntsberry and talked about how difficult this was, reiterated that point, and then the next day spoke with the UT and said that if these budget cuts happen, then distance learning would continue in the fall. And then he said, quote, it would be a lesser version of what we're doing now. And what we're doing now is extremely stressful for students, parents, teachers, and staff. I do not know what a lesser version of what's happening now is. It feels like they would just come to our house and throw something at it, maybe a bundle of papers or
I think they would come to your house and turn on Bill Nye the Science Guy and then leave, and that would be it.
It's really been hard for us to follow. I don't know if a public policy dilemma has so intimately affected me and worried me that I've followed, and I just don't see the way out. We see progress all the time. All these people excited about going to the restaurants and the bars and getting hair salons open, and it feels like schools are going in the opposite direction. Like it's getting worse and more murky. The superintendent of Cardiff School District sent out a pretty benign email to people with students in the Encinitas area saying, what do you think you need on this stuff? And then it's speculated that they're likely to use a hybrid model where students attend school for just part of the week. And Encinitas Mayor Catherine Blakespeare responded very intensely with, hey, that's not acceptable. You need to meet the moment and get schools open. We can't handle this like this any longer. Kayla Jimenez did that story for us. This is just, I don't see the way out. Is this just brinkmanship? Should I just bury my head and it'll be okay?
I have no idea. It may be. There's multiple ways to read it. One is that it's a threat of some kind. It's a negotiating ploy that don't go forward with these cuts, or else you'll have to grapple with us. And particularly if a bunch of large districts band together and adopted this position, they might have quite a bit of leverage over the state, I guess. But for it to be a credible threat in that situation, it would have to be the case that school districts do have the ability to refuse to open in a case where they were told to open. Right now they're not allowed to open if they wanted to, right? Whereas if the state were to say school is back in session, the social distancing rules, the lockdown phase 4, whatever, is no longer in place, would school districts be able to say, we will not resume in-person classes?
So Will Huntsberry actually talked to a lawyer about this, and his conclusion, although it's pretty murky and there are a lot of factors in there, is that the state would have to allow school districts. So that creates like a weird infinity loop in which they're threatening to do this to spite the state, but they actually would need the state's permission to not open.
Right.
One thing that I do kind of think this is brinkmanship, and part of that is because the San Diego's court system held its own sort of press conference about its reopening plans this week, and they happened to mention that they're facing a budget deficit that could be far greater than anything that they experienced during the last recession, and courts were impacted dramatically during the recession. There were, like retired judges being called in to hear cases in classrooms because it was just a mess. And yet you don't see anyone representing the court system saying, well, we're not going to have courts anymore unless we get this money. And, like children have a constitutional right to an education in the same way that people have a constitutional right to a jury trial. And so you have two different systems facing these big hits, and only one of them is saying, well, we're not gonna open if we don't get what we want.
Well, when I was watching that live stream and I asked on the little Facebook chat, are you saying that in the fall, if these budget cuts happen, you will not open? And she said, we are open. So I think that part of the flaw there is this discussion about, is what they're doing now school, and does it count? There's a lot of people talking that teachers are mandated to do a 4-hour workday right now. There's this distance learning thing that's happening. There's this, is that school enough? And if it's a worse version in the fall, if the state says you have to have school and that's what they do, is that school? Does that count? So that kind of circumvents the point you're making about whether it's allowed or not. What is school is now a really interesting question. And then the other point is, they can't not have it if the state tells them to, but the teachers union and other unions can stop work and have proven to be able to do that sometimes. So if they're not comfortable with whatever the arrangement is, that could be part of what delays any kind of action, even if there is a mandate.
Yeah. So there's all that, which is great news. Yeah, I don't know. I mean, it's so this is while facing a 10% cut, basically. And meanwhile, they have Richard Barrera laid out to Will what a reopening plan would look like, which basically involved limiting class sizes by essentially halving the amount of time that kids spend in actual classrooms. When they aren't in classrooms, they would use the entire campus to provide sort of groups that it would be some sort of social or activity group, I guess, that could happen in parking lots or playgrounds or gymnasiums or cafeterias or auditoriums. So you'd use all this other square footage of the school that is not typically used all the time. And then the other kids would stay in a classroom with a teacher. But they said that would actually be more expensive than normal. So they wouldn't be able to do that with the 10% cuts. So I really just don't know how much of this is grappling with an unsolvable problem versus essentially a budget fight.
Yeah. Well, I think also it's hard to watch. There's, billions of dollars they've raised in taxes over the last decade, 12 years, for construction of physical space on the campuses. And it's just really hard. A lot of those construction efforts are going forward. We'd sure love to be able to access some of that money if they need it to retrofit the classrooms to make this possible. It's really something to watch. All right, another issue that has remained controversial even through the pandemic is AB 5, the law that designates when employers can classify somebody as an independent contractor versus a worker. That has been a law for a while. It has been very contentious, and now there are efforts to clean it up. What happened this week, Sarah, and where are we with the various laws to change it or get rid of it?
Yeah, so this was the first time that the sort of follow-up cleanup bill, AB 1850, finally got a hearing in Sacramento. And for the most part, Assemblywoman Lorena Gonzalez heard, I think, loudly and consistently from two groups after AB 5 passed. And that was freelance journalists who, we've talked a lot about, as well as musicians. And so this bill deals with both of those groups, but then it also just loops in a number of exemptions for other groups of workers who I'd never even heard about being involved in this. And so it continues to just loop in all kinds of professions that you never even thought of. One of them is referees for different games, people who conduct certain kinds of appraisals. So just every type of work you can possibly imagine has been impacted by this. So she's trying to appease freelance workers in a lot of ways. She has lifted the 35 article cap that was a big problem for many journalists, and made some other tweaks and concessions. She did still write in provisions that, employers can't just take existing employees and convert them to being independent contractors, which is something we've heard of even locally. A few people from the Coast News had said they were regular employees and then had all those protections dropped when they became independent contractors. So there are still limits in which she tries to retain a lot of those protections for them.
Yeah, so in essence, they passed a law saying that if you're an independent contractor, you can't be doing the work of the organization that, if you're a baker at a bakery or a journalist at a newspaper. But then they saw just how many people that actually affected, which was all these musicians and what you mentioned, this list of people. And so they've systematically been excluding people from the law to the point where it seems like it's now boiled down to it really impacts mostly these gig companies like Instacart, Uber, Lyft, all these places that, say that they're actually just platforms connecting drivers to riders. But, these lawyers are now arguing that, no, in fact, those drivers are their business, thus should be workers.
I think that's certainly the group that she's maintained all along. She has no interest in discussing any exemptions for. That being said, like, the worker classification issue was one that's been around for decades. And so I think there still are a lot of workers in very traditional roles and sectors that have been around for ages that are wrongly classified that she's trying to address here. One thing that I thought was really interesting reading this bill again this morning is that, she's still kind of clawing back some of the AB5 provisions and changing it to make people happy. But there is a provision in this new bill that actually kind of moves it forward, and that is by empowering district attorneys to sue under the law. So right now, AB5 gave city attorneys the ability to sue some of these employers who they believe are wrongly classifying workers. And that's why you saw San Diego City Attorney Mara Elliott sue Instacart. She's also involved in the lawsuit against Uber and Lyft. And this would take that even further and allow district attorneys to start filing some lawsuits if they believe workers are being classified wrongly.
Is there some sort of trait that is common among the professions that have been granted this extra exemption within the last couple weeks, other than that they had organized around opposing the bill and had generated some political opposition? I mean, is there something endemic to those professions that groups them together in a logical way beyond the fact that they had become a thorn in the side of the bill from a public relations perspective?
I think it's the people who are able to make some sort of case that they control their own work and that they are not really behest to the direction of an employer.
That they are in the spirit of an independent contractor.
Right.
Wow. So that's another big debate to watch. Do we know if the Uber initiative qualified that would, change the status? They wanted to create a third status of employee that said that basically fit them, that they would give some minimal benefits to, but wouldn't be an actual employee.
I'm pretty sure that they've submitted their signatures. I don't know whether it's been certified yet, but I mean, they spent $1 bajillion, so I would imagine they have a lot of signatures.
Well, yeah, I mean, there's one thing that we can say with certainty is that no well-heeled signature-gathering opposition could ever come up short in some way or another, in any other way, botch the scenario that makes them change their plans after the fact.
Sure.
All right, we're going to take a quick break. On the other side, we'll hear from UC San Diego epidemiologist Rebecca Fielding Miller about risks, how you live with them, and tests. Stay with us.
Hey y'all, I'm Will Huntsberry. I'm an education reporter and one of the hosts of a show called Good Schools for All. It's a podcast all about schools, how they work and how they don't. This season, we'll bring you stories about struggling schools, preschools, and an unprecedented scam that cost California tens of millions of dollars. Catch the new season now, wherever you listen to podcasts.
This week on the Voice of San Diego at Home series, I interviewed Dr. Rebecca Fielding Miller. She's an epidemiologist at UC San Diego's Division of Infectious Disease and Global Public Health. I wanted to talk to her about what risks she is willing to take. She, for example, got a babysitter the other day. Why she made that decision and how she got her way through that is really interesting. She's an expert, of course, on infectious diseases, in particular on HIV, and there's a lot of lessons she said we can take from how they dealt with HIV. Testing, for example, know your status was a big part of how the community moved on and lived with the disease. And we had a few questions also from our audience, and she took them all. Here is Rebecca Fielding Miller.
Well, I'm a professor of infectious disease and global health at UCSD. So previously that looked a lot like people asking me to look at their rash when they didn't quite understand what epidemiology was or what kind of doctor I was. But now it involves a lot of talking about COVID-19 and why you probably shouldn't go to a hotel room
Tell us
just
why.
because you're bored standing at your own four walls. I think actually one of the biggest risks to a hotel room would not necessarily be to you. I would worry about the staff at the hotel room. So the more people touching more things, sneezing on more things, the higher the risk to the people who have to change those bed linens and bring you food and take care of you as you get some mental health benefits. So for me personally, I would not do that.
Yeah, but you came to my attention because you did post something about we do need to accommodate some mental health benefits, that we are going to start to transition to a living with the risk type of situation. So you actually have worked for years studying HIV in Africa and in other places. So talk about what you know about infectious diseases and just what we need to be thinking about as we transition to living with the risk.
Yeah, so I by training, I'm a social epidemiologist, which means I think about all the ways that sort of our social lives and our society affect our risk of getting sick. A lot of the times it turns out that if you are poor, you are at higher risk of being sick. And I would say about 60% of my job boils down to that. But I've spent a lot of time sort of working in sub-Saharan Africa around HIV, and thinking about kind of this intersection of social and economic inequality and how that really drives the risk. And one thing that we have really learned in about 30 plus years of working with a virus which manifests slowly and spreads quickly and is transmitted socially and has no vaccine is that one of the best ways you can contain it is by knowing your status, knowing the status of your network, and kind of just constant testing. Testing has been the mantra in the HIV field for a really long time, know your status. And I think there's a lot of overlap with COVID-19 because we know that in the first few days before you have any symptoms is probably when you're the most infectious. We know that a lot of people don't show symptoms for a very long time, if ever. And one of the only strategies that we have to sort of break those chains of transmission is people knowing their status early and not being within 6 feet of other people as soon as possible.
One of the things I wanted you to explain was testing. We mounted a testing tracker on the site, thevoiceofsandiego.org, because we wanted, if they said we needed 5,200 tests per day, well, then what are we doing to get there? Let's keep track of that. People ask me all the time, like, what does testing matter? And what does the positive rate matter and all that such? And I fumble through, I think, a pretty good explanation, but I bet you have a better one. So when somebody asks, why is testing such a big deal? What can you do to explain that? You said know your status, but what's happening with all that?
Yeah, so testing, especially in February and March, I want to say the beginning, but I feel like time just has no meaning at this point.
Yeah, right.
But one of the reasons really early on why we wanted to push testing is we needed to know how big the problem was. You cannot even begin to address a problem if you don't understand its scale. And so testing was a way that we could begin to get a sense of how much of an outbreak do we have in the county. As things moved forward and testing capacity grew and we had a reasonable sense of where we were, testing can also let us know sort of how quickly is COVID-19 taking off? So how many more people are getting sick each day? Is it safe for us to go out and see one another in public in an open space, or do we all need to stay home? So it gives us a sense of the speed. And for individuals, it lets you know if you need to maybe stay home to protect other people. So for example, is it safe for you to go and get an elective but important procedure at the hospital? Testing lets you know that it is safe. Now, as we kind of move into, I don't know, we're at the end of the beginning. Is that one phrase that we're using a lot?
Sure.
The thing that needs to go with testing is contact tracing. So when we start to see, I think, positive rates below about 10%, that says we're doing there's a reasonable testing capacity. So now what we need the ability that if somebody does test positive, we can go out and make contact with everybody who they have been around for. I think the metric we're using is more than 15 minutes in the previous 48 hours-ish. And what that lets us do is it lets us find people while they are totally asymptomatic, make sure that they are supported to self-quarantine and prevents them from transmitting to other folks. So it lets us break off that chain of transmission before it starts and before it accelerates.
Got it. And so let's talk about the positive rate for a second. So you mentioned 10%. The county's been reporting about 3 or 4% now consistently for a while, which I think I've come to understand means if you have a low positive rate, you can be reasonably sure you have a handle on how widespread the disease is. Is that fair?
I think so. I think there is so much that we are still learning about this, but I do think if you see, so I've been keeping an eye on this, and I've been seeing that the number of new cases each day seems to be remaining pretty steady, even as the number of tests go up. And that is a reasonable indication that the prevalence, I should say the incidence rate that we're seeing is probably about right. The other thing that is worth keeping an eye on to verify that is the number of people who are dying of COVID-19 each day, because that is easier to catch or to see in a lot of ways, and that number has also been holding steady for a while. So it seems likely, if I couldn't swear to it, that 3 to 5% might be about our current prevalence in the county.
We had a county supervisor, Jim Desmond, talk about that death rate in particular, and he decided to make a point that only 6 of the, say, 210 or so people who have died from COVID actually died from COVID alone, that it was, that everyone else had underlying conditions. And my first reaction to that is the number of underlying conditions is just really prevalent in the community. There's a lot of people who have high blood pressure and stuff. Just this seems like and I don't think they deserve to die. I don't think they're like on their way to death. And so if this caused that, then that's something to keep in mind. What do you think of when something like that is said, that the death rate, should be boiled down even further to these just few who are specifically affected by only COVID-19 at that moment?
I would question the utility of doing that, of boiling things down to 6 instead of hundreds or thousands. Because what does that actually, I don't know what information that would give us that is more useful. So we have a vast spectrum of human health and human behavior, right? Like everybody has something going on. And I don't know that it would be accurate to say, well, this person died of asthma when they actually died of COVID-19, right? And I think that there is always an urge to want to reason why you and your family are safe, why those other people got sick but they had something else going on and therefore this can't affect us. And I think that's a really reasonable human urge, to come up with reasons why it won't affect you and you're okay. But I think the truth is we are still learning a lot about this disease, and while pre-existing conditions definitely do put you at higher risk, I don't think somebody was going to pass away the next day because they had cardiovascular disease, and yet today their family doesn't have them. And I think it's important to count them correctly.
You talked a lot about risk, management of risk. You yourself talked about how you have a toddler, right? 2.5-year-old. And you decided to bring a babysitter in to work with you so you can continue to get your job done, which seems important now.
Trying.
Seems like of all the jobs that need to be getting done, yours is probably up on the top of the list. So what made you go through that risk assessment, and how are you telling people they should manage their risks as far as seeing people, bringing babysitters in, going to see the grandparents, that sort of thing?
Yeah, I think it's an interesting question because there's 2 things that we have to balance, right? We have to think about how to keep ourselves individually and our family safe, but also because this is an infectious disease, and a lot of the times we don't know if we are infected unless we have very recently gotten a test, and even then we don't know what happened 5 minutes after that. Our behaviors, our choices also affect the people around us, and I think it's really important to keep that tension in mind. So I myself, for my family, for about 6 weeks, my husband and I traded off. I was with my 2.5-year-old until nap time, and he was with her post nap time, and we kind of limped along and did our best, because to me, it was really important not to be a link in a transmission chain, and we had the ability to do that. And so I wanted to do my part and make sure that nobody else got sick because of something I did. After about 5 or 6 weeks, that stopped being really tenable for us. And so we did talk about it quite a lot, and we decided to ask a neighbor, a 16-year-old neighbor, to babysit for us. And we do try and be really thoughtful about that, in large part because we want to protect her family. I'm not going anywhere besides my deserted office. My husband never leaves the house, but we want to make sure that we are not affecting her family. And that was a really frank conversation that we had with her and with her parents, to make sure that everybody knew. And we figured that it seems possible that small children have lower viral loads, although they are very damp. Our babysitter is younger, and we decided as a collective set of families that was an okay risk for us. But it wasn't. It was not 0% risk.
Yeah.
But it was the trade-off was worth it to us.
Okay, let's take some questions. Wendy Wheatcroft wrote, kids and playdates with friends. How should you analyze that risk?
I think, so we know that we know that you can't stay in your house forever. We know that we cannot stay completely isolated. Obviously, if everybody did that for 14 days, this might be done, but that's not going to happen. It's just not feasible. If the safest way that you can socialize with somebody else is to do it outside, at least 6 feet away, with masks if you can, and no touching of the same things or one another, which isn't like fun. That's not as fun as like having brunch on a Sunday or like a potluck, but it's still better than sitting in your house alone.
Yeah.
I think kids are hard, right? How do you explain social distancing to a 2-year-old? Kids want to hug one another. They want to hug the adults in their lives. And so we did visit with a friend at a distance outside the other day, and it was frankly really heartbreaking that my 2-year-old who adores this friend couldn't give her a hug. And I think you as a parent have to kind of make your best judgment. Are there enough people who are already in a household with the kid to sort of prevent that from happening? Or are your kids old enough to really understand that? It's hard. And you know what? It might not be possible. Like, people make mistakes, right? It might not be possible to do that 100%, but as long as you are doing your best in the 90%, that's still great.
So would you go to a party in somebody's backyard where you brought your own food and you stayed reasonably distant, but the kids might run into each other every once in a while, that sort of thing?
No, I wouldn't do that. No.
That's good. Okay, let's take a different angle. We had another commenter who was, I think, more on the skeptical side.
Mm-hmm.
As testing shows that more and more people were infected without symptoms, and that people are having life-threatening problems with COVID are people with pre-existing health issues. Is it safe to say we went too far in our response? Do you think we went too far?
I think there's data coming out that literally tens of thousands of lives have been saved in California. And I think that could have been somebody that any one of us cares about. And I think that this is not too far to save my mom, right? This is not too far to save your cousin or your neighbor or somebody you care about, or you. We know that people with pre-existing conditions, people who are older, are at higher risk, but we also know people in their 20s and 30s are getting this. We're seeing strokes, we're seeing strange and kind of really concerning syndromes in young children. So the probability is higher with older folks, but it's not zero with younger folks. It is a reasonable question to say, if only 200 people in the county could potentially die from this, then why do I have to wear a mask in Costco?
Mhm.
And I think it's a fair thing to ask. But I also think we do a lot of things as a society to protect one another, right? We have all agreed you cannot do 6 shots and then go driving, even if you think drinking makes you a better driver. We have agreed that's not allowed. We have all agreed you have to drive your car at a certain speed sober. And we do these things, we put these restrictions on ourselves to make all of us safer. I would also suggest that one thing that does affect you is you do not want the hospitals being overwhelmed. So we have been in this shelter in place, not necessarily to protect individuals, but to protect our health system. And I think that hasn't been emphasized enough. You do not want your health system so overwhelmed with COVID cases that you can't go to the ER if you have a broken arm, or your kid can't go to the ER if they spike a fever in the middle of the night. So this is actually, it's not for the 0.2%, it is for all of us who need doctors and nurses to be available for us when we are sick of anything.
Yeah. As we start to see, like the hospitals seem to be in a position of they could use some more business now, the more volume. I think from what I heard from you earlier, yeah, it's okay to start loosening as they've proven they have that capacity. But but we're going to have this long-term sort of equilibrium with this disease in a way. We have a lot of questions about masks. Here's a colorful one. Am I an a-hole if I run in the streets without a mask? A lot of people are okay.
Quickly and 6 feet away from people. It's fine. I don't know how you would go for a run in a mask. I was a runner for many years, and then I had a toddler. I don't know how you could run in a mask. It's fine. Stay 6 feet away from people and be quick.
So the point of a mask is if you're around other people, put on a mask, and it'll keep you not only from coughing into their space, but also it keeps you from touching your own face and stuff like that, right?
Mm-hmm. Yeah.
Okay. Let's do another question. This came in. This was an interesting one as you talk about know your status. He says, it came in on Twitter. If we normally go to Montana in July, we drive there, we hang out with my parents. They're in their 80s. Dad has COPD. If we got tested before leaving, drove there with minimal stops, stayed isolated with my folks, is that still a bad idea? And I know, full disclosure, you're not going to be able to give him a perfect answer, but how would you go about analyzing that risk?
Mm-hmm. I will tell you how I have thought about that in my personal life and what I would do. And then I would suggest that you do your research and talk to your parents too. So for us, pre-babysitter, when I knew where everybody in my house was at all times, and that it didn't even involve grocery shopping. We have a lot of subscription services now. I would visit with my parents. So my parents came down for Mother's Day, and it was lovely. We went and saw them for my mom's birthday, and that was because I knew they weren't going anywhere because I kept yelling at them to not go anywhere. I knew we weren't going anywhere, and I felt reasonable about that. Now that we have somebody else coming into our household, now that we're connected to a broader network, I would be a lot more cautious about that. And I would not visit my parents, probably unless everybody had gotten a test. We waited 4 to 5 days. We did it again just to be sure it didn't catch us early. We waited a couple more days and then we went. I would feel comfortable with that level of risk, but my parents are sort of older, so to speak, and don't have any underlying conditions. I think everybody needs to weigh out what their personal risk scenario is and have a really frank conversation about what your parents in particular are comfortable with.
That's fascinating. So do you think, so you've followed HIV for so many years, the test, is that kind of testing available right now for HIV, that sort of rapid, weekly kind of thing?
Yeah, so it's actually amazing. You can get a test, usually a finger prick, and you can see your results in minutes. It's really fast. It's really widely accessible, especially in sub-Saharan Africa. If anybody on here is thinking about getting an HIV test, Planned Parenthood is a great place. There's a lot of resources in the county. It doesn't hurt.
Yeah.
And you can be linked to resources pretty quickly. And I would love to see something like that for COVID, like a fingerprint, a cheek swab, it shows up purple or blue, and you know when you can go about your business.
So if you had let's say a lot of us are thinking about summer camps, and one of the things that caught my eye, you said like summer camps should all be outside. Let's get kids outside. So I think you're okay in some way with kids being together, maybe outside or with some precautions. You go inside, you wash your hands, that's it. Is that a fair summary?
Yeah, so my husband and I talked about this. We know that childcare is probably going to reopen fairly soon, at which point it's going to be a bit of a switch for those of us who have had 2-year-olds and been struggling, and those of you who have had 8-year-olds who can entertain themselves a little bit.
Yeah,
and we decided that we were comfortable with sending our kid to childcare. But one thing that I think is another role that testing can play and that parents can do to be really responsible and make sure childcare stays open is parents knowing their status, right? You want to be able to pull your kid out of the pool quickly if you think anything's going to go wrong. So for me, for childcare, for 3-year-olds, I would say the more you can be outside, the better. Every day is slip and slide day, right? Like every day is nature walk day. And that's because we know that the more ventilation, the better. We know it gives teachers and staff fewer things that they have to disinfect if the kids have been running around on a lawn. That's just less work for them. And it keeps the teachers safer too, even though children are, again, damp. And I say that with a lot of love for mine. One of the things that schools can do and can think about is the size of a network that is connected through a classroom or a school. It's actually quite a lot of people. And the more quickly we can let people within that network know if there's a risk, the more quickly we can sort of break off a transmission chain within that network, the more the majority of people can keep using the school, or the more the school can stay open. And I think that's going to be really uncomfortable, right? Like nobody wants to be the parent who, now you're stuck at home because your kid licked a flagpole and like you can't go to work. But better you and your kid for a few days than the entire school for a month, right?
Yeah, so that gets back to your point that testing is just the crux of everything. It is at the heart of all of what we want to get done if we want to manage the outbreak and continue with some semblance of life. And so, at schools, what you're basically implying is some sort of rapid and available testing regimen that can allow us to spot one of these things without paralyzing the entire system.
Mm-hmm. Yeah, I think testing and contact tracing. And I think that the contact tracing in particular is going to be key. Just testing requires people's sort of goodwill to remove themselves and to let all their friends know. But testing and contact tracing means that somebody gets in touch with you when you test positive, and then they reach out to everybody you've been around anonymously. They say, somebody you know has tested positive. Here's where you can get a test. Here are resources for you to take care of yourself. By the way, who have you been around? And we need a lot of that.
How long did it take for HIV tests to get to the point where they were that available? Like, do we know how long it might take to get to the point where we could have the kind of testing that you're talking about? I mean, if that's the goal, that would be really nice.
That is such a good question. I don't know the exact answer. I do know that HIV is actually, in many ways, the story of the science behind HIV is a story of phenomenal community advocacy from the LGBT community around the world. And we have fast tests now. We have the treatments we have now because of pushing and advocating from that community. If anybody's interested in some really deep nerdery about sort of the place where science meets politics, there's a book called How to Survive a Plague that's just a massive tome, but describes how we got to where we are with HIV. And it's politics just as much as it is science. That's
fascinating. Well, Dr. Fielding Miller, I really appreciate it. It seems like a lot of people are really grateful you came on. One suggests maybe next month we check in with you. Would that be all right?
Sure. No, I'm happy to. Especially if daycare is open.
Yeah, right. Exactly. We'll have more time. All right. Dr. Rebecca Fielding Miller from UC San Diego. Thank you so much for taking the time.
Thank you.
Thanks for listening to the Voice of San Diego podcast. It is the single most popular public affairs podcast recorded in my kitchen and in the bedroom of Andrew Keats and in the bedroom of Sarah Libby. Our interview this week, as well as our bonus episode for the week, came from our live stream series, Voice of San Diego at Home. If you haven't caught it yet, it airs Monday, Wednesday, and Friday at 1:30 p.m., and it's available afterwards, so you can watch it at any time. Find it on your favorite social media app. We are Voice of San Diego on all of them, and you can keep up with everything we do with our Morning Report newsletter. Get that at vosd.org/morning. I'm Scott Lewis, CEO and Editor-in-Chief. Andrew Keats is Assistant Editor. Sarah Libby's Managing Editor. And this show is produced by Nate John. Thank you for listening. We will talk to you next week.